Hi, and welcome to this presentation today. So we'll talk about the importance of sex counseling for older couples, enhancing intimacy and relationship satisfaction in the booming golden years. So Tom Petty once said, "If you're not getting older, you're dead." These two things are certainties in life, but they are also a choice. So the right choice is pretty obvious to most of us, anyway, because the World Health Organization says that the most common mental health conditions for older adults are depression and anxiety, and this can greatly compromise someone's will to live. So the choice might not be that easy. Sex, and not just the sexual act, but general intimacy in our relationships, can help combat mental health disorders that contribute to a diminished quality of life. Now, I just can't think of a better way to spend my golden years than in a safe, intimate relationship. And also, to be honest, if I gotta go, then I can't imagine a better way to go than while having sex. So, yes, sex counseling for older couples is essential for addressing the unique physical, psychological, relational aspects of sexuality later in life, promoting sexual health and enhancing overall well-being. So who are we talking about? Who are these golden gals and guys? Generally speaking, we're talking about those 65 and older. They're also known as boomers, right? The baby boomers, which are a cohort of those born right after World War II. Roughly, that's between 1946 and 64. So Americans at the time were happy when the war was over. They had this renewed spirit and hope in family life, and we're having sex and lots of it. And boom, 3 million babies were born. That was only in 1946, which was more than ever in history. And now, guess what? Those people, plus most of the other 76 million boomers, lived. And because of this, the number of Americans aged 65 and older was projected to increase from 58 million in 2022 to 82 million by 2050. And that's a 40% increase. And uh, we are kind of on track for that. And the 65 and older age group share of the total population is projected to rise from 17% to 23% also in 2050. Something worth noting is that life expectancies had been increasing with advancements in education, medical tech, and the sort. So people are living longer, but recently that trend had stalled. However, the COVID-19 pandemic has been a huge factor in that change. So now that we got a bit of a handle on that situation, we may see those gains again, but we've yet to see if that proves true. Nevertheless, the baby boomers are a very large group, and the correlation between their sexual health and life satisfaction and making them happy is worth exploring. So, common sex issues, sexual issues. What's getting in the way here? What are the problematic issues? For men, erectile dysfunction, or ED, is the most common issue reported. That was really easy to find. Tons of studies out there about this. ED is the marked difficulty of maintaining or having an erection. Information regarding aging women was a little bit tougher to pinpoint down to like one issue, but I found that arousal was a major issue, and arousal disorder can be defined as the absence or reduced sexual sensation or receptiveness. Also, many issues were attributed to menopause, the prevalence of decreased libido, and genital pelvic pain and dryness were issues. Pain during intercourse was reported by both. For women, again, it is often the genital pelvic area, but both also report joint and arthritic pain. Ironically, sex can be a tool to alleviate joint pain, but we'll get to that a little bit further up in the presentation. Other issues include physical body strength, mobility, um, when it comes to performance, men's virility, which includes psychological factors due to loss of fertility and stamina, body issues, body image issues, changes in relationships such as loss of a partner or changes in intimacy dynamics can also impact sexual desire and satisfaction. Certain medications commonly taken by elderly women, such as antidepressants or blood pressure medications, can have side effects that affects sexual function. And of course, there are other chronic health conditions such as diabetes, arthritis, and heart disease, which can affect sexual function and desire. So let's delve a little deeper into some of these issues and how they influence sexual health. Cardiovascular diseases like hypertension or coronary artery disease affect blood flow to the genital area. Um, they should be coming up here soon, but just go over them. Diabetes causes nerve damage and vascular problems, and both of these can lead to erectile dysfunction in men, and decreased arousal in women. I've mentioned also arthritis, which causes pain and stiffness, um, making sexual activity uncomfortable. So osteoporosis is also a condition that weakens bones, which can lead to breaks or fractures, which can lead to avoidant behaviors. They're afraid that they can break or fracture something. Neurological disorders, strokes, Parkinson's disease affects nerve function, increasing sexual dysfunction. Both men and women experience hormonal changes also. Um, Aging causes decline in the sex hormone testosterone in men and estrogen in women, and this affects their desire and ultimately sexual satisfaction. Psychological factors include depression and anxiety, which again are commonly occurring in elderly persons and co-occurring in elderly persons. Things like life changes, again, perhaps the loss of a spouse, issues with health problems, or the medications used to treat those health problems can bring about these conditions, also impacting desire and performance. Other psychological conditions include stress, again, due to life changes like retirement, loss of income. We've discussed loss of spouse, which causes grief, which is an intense and sometimes overwhelming emotion for our older adults or anybody actually. Cognitive impairments like dementia that affects communication skills, engagement and enjoyment and memory. So there is the potential to literally get lost in the moment, but when having dementia, coming back from that can be traumatizing to, your client's partner, and, the people that they surround themselves with. Medications also play a role. Some of the side effects of many prescribed medications for chronic conditions affect sexual function. Again, a lot of the same issues are mentioned in medications. Antidepressants are known to cause decreased libido, ED, and difficulty achieving orgasm. Blood pressure pills associated with premature ejaculation and chemotherapy affects hormones and can also cause nerve damage. So what are the benefits of counseling? These challenges can be addressed, and we can benefit from couples. Elderly couples can benefit from sex counseling. Couple sex counseling can improve communication because the therapeutic environment can provide safe spaces for individuals to express their concerns and desires to their partners. This in turn increases intimacy. Hopefully, the amount of time that these partners have grown together have already increased their fondness and consideration of each other, but gains in intimacy can be vital to health. It has been found that expressive emotional intimacy, especially in male partners or coming from the male partner in older couples, is tied to the couple's overall sexual well being. Sex counseling can enhance sexual activity. Couples can discuss what they can and cannot do together with the counselor. They can explore different or new techniques. There are a ton of ways to do it, but it's important to consider the abilities of each individual and take safety measures also to prevent any negative feelings towards an activity that is meant to bring enjoyment and satisfaction to the relationship. So we have to consider what ways are best for the couple. Sex counseling can address relationship issues that may be impacting sexual intimacy also, such as conflicts, trust issues, emotional distance, sexual trauma, and maybe performance anxiety, so to speak, might be heavy issues to discuss when in any relationship. And that's no different for older couples, especially in a very new relationship. A partner may become distant for these reasons, and the other person is just clueless about the situation. So, in order to reap the benefits, there are certain competencies and characteristics that are desirable in a therapist, and not just sex counselors, but this overlaps many specialties. So, I've mentioned creating safe spaces, which includes physical spaces too. The ambiance should be calming. The counselor should try and prevent any disruptions in the session, so location is important. Elderly persons may have mobility issues, so furniture placement, accessibility must be considered. You must have a non-judgmental attitude so that individuals feel heard and respected enough to share some of their most intimate thoughts. Also make them aware that the sessions are confidential, which helps rapport and building that trust foundation. Be an active listener. Listen, ask questions for clarification if needed. Empathize with their experiences and emote that compassion. Become informed about how clients' culture and their influences affect their thoughts about sexuality. In order to form a collaborative approach with some of our older clients, therapists should become knowledgeable in elements and issues affecting aging populations to formulate attainable plans and goals. Flexibility is required to address each couple's need as an individual unit. We should be able to tailor or adapt to their needs when it comes to any counseling approach we choose. So, what models and approaches are these awesome sex therapists using, right? So, we have cognitive behavior therapies, psychoanalytic, narrative. We can also use sunset focused and emotionally focused therapies or combo, so we can take an integrative approach. So, cognitive behavior therapy, because sexual dysfunction can't be completely cured by like a blue pill. It's not just a physical ailment, it's also psychological. Cognitive behavior therapy helps individuals identify and change negative thought patterns and behaviors that may be contributing to sexual issues. Different behavioral approaches can address issues with performance anxiety, implementation of new or safer sex technique, and learning how to talk to each other, open the lines of communication. Psychoanalytic approaches, those explore unconscious thoughts, feelings, and conflicts through talk therapy. Sometimes it's past or childhood experiences that dictate the attitudes we hold about sex. So the lack of understanding can greatly impact a person's sexuality and the relationships with their partners. The benefit of psychoanalysis, or some of the benefits of psychoanalysis, is that it can help process guilt, trauma, shame, marital discourse, distrust. Narrative therapies. This can help clients reframe. They can help. It helps clients reframe their personal narratives around sexuality. Therefore, they can challenge their dominant culture narratives, things possibly pushed on them, and they're able to explore alternative perspectives. Sensate focus therapy uses touch primarily, although other senses can be incorporated. The therapist teaches couples specific exercises designed to increase awareness of sensory experiences, usually starting with non sexual touches, gradually progressing as far as the couple wants to take it. Um, This helps to focus on the sensations, the relaxation, as opposed to actual performance. So we're addressing issues like anxiety, stress, self-image, body issues, or shame. Um, it can increase our comfort, helps make stronger physical and emotional connection with partners. And emotionally focused therapies use the basis of attachment theory. As a form of psychotherapy, EFT focuses primarily to discover how our emotions are tied into our interactions with our spouses. We can pinpoint, find those negative aspects, and develop strategies and coping mechanisms to function on a more positive level. Also, keeping our emotions in check, like stress, help with pain management. So let's take, for example, stress. Physical pain can be tied to stress. Recognizing the emotion, the client, the partners, the counselors can come up with a plan to minimize the stress, like better nutrition, better sleep, and well, sexy time can help in that area also. So, sex therapy can be implemented using an integrative approach. A combination of different interventions may be necessary to address each client and their specific individual needs. As I mentioned before, they can overlap, like using psychotherapy and CBT to recognize our thought and change those behaviors to improve a situation. Or we can combine, draw from other theories, emotion focus, culture centered, others to take a more holistic approach to therapies with our couples. Being aware about the client's underlying medical conditions will be important. Knowing what medications they take, including those for sexual dysfunction already, or hormone replacement therapies. If possible, therapists should collaborate as a part of a team with their clients' other medical professionals so that everyone is kind of on the same page. So, in conclusion, having sex in our older years does not have to be non existent. It is not true that we get too old for sex. There are some limitations, but it is still possible. Creating safe therapeutic environments and building relationships with our elderly couple clients can help ease them into conversations that will address the issues that they are facing and consider the mitigating factors that are preventing them from having healthy sexual lives. Explaining the benefits of sex counseling and doing so in a compassionate manner will help with exploring the best therapeutic interventions and create plans to satisfy those sexual needs, therefore increasing their life satisfaction. And I think certainly those couples will agree that they have earned the right to enjoy the best of their golden years. Thank you for your time. I hope you found this information helpful, and thank you for your time.